That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdelaziz Al Khayyat, and having coffee with us today is Dr. Joanne Hands. Welcome, welcome.
Thank you. It's a pleasure being here.
We're so happy to have you here. So a big theme of this podcast, for those of you watching or listening, has definitely been mental health. We've heard a lot from doctors about their thoughts on looking after the mental health of their patients and looking after the mental health of themselves. However, today we're going to gain perspective about mental health a little bit outside of medicine. For the first time on the podcast, our guest is a non-medical doctor. Dr. Joanne Hands is a clinical psychologist or clinical psychologist?
Clinical psychologist.
Clinical psychologist who earned her PhD from the Chicago School of Professional Psychology in Chicago, Illinois in the States, and her master's in science degree in clinical mental health counseling from Loyola University in New Orleans, Louisiana. Yeah, that must have been fun.
Yes.
I always wanted to go to New Orleans.
Yeah.
And in Kuwait, she is the clinical director for the Kuwait Counseling Center, and we're going to talk a little bit about her work there and what the center does. And she's also working as a therapist there with over 23 years of experience. And on top of that, she's done literally everything. I just found out minutes before taping that she had a TV show on KTV for some time. She's the president of the Middle East Psychological Association. So once again, we have another person on the podcast that does literally everything, and I'm so happy to have you here because when we bring on people like yourself, we always get this comment of, this was so inspiring, I learned so much, I want to follow in your footsteps. So I'm really excited to have you.
I hope I can be inspiring too.
Already from this 2-minute discussion that we had before taping, I'm already inspired, very excited to dive in here. So before we go into things, we always talk about two things. We're going to do some shout-outs, we're going to do some coffee discussion. First, let's, the elephant in the room.
Coffee discussion.
There's no coffee over there.
No coffee, just water.
Just water. So again, another sin committed on the Doctor's Brew. We apologize.
Yes.
Dr. Joanne does not drink coffee.
Never. It's interesting because when I moved to Kuwait 18 years ago, everybody was telling me, you're the worst guest because the first thing they do is to offer you coffee. Mm-hmm. And if it's not coffee, it's tea. And I don't drink any. I don't drink coffee and I don't drink tea. When I have to have something, then I would just ask for like some chamomile or jasmine tea. Mm-hmm. But it's just not something that I developed a taste for it. I just cannot. I love the smell of coffee, but I cannot stand the taste of it, and in sweets and desserts and nothing. So my wake up is just a good cold shower, I would say, and my energy is just internal. It's just I have a lot of energy naturally, so I don't need a coffee.
Can I just specify that the views expressed by guests are not those of the Doctor's Brew?
Yeah.
No, it's I mean, I get it because when I was in high school, I didn't drink hot drinks, including coffee, including tea. And I remember when I was, funny enough, in France with my dad, I had green tea for the first time and I liked it. And I was like, oh my God, I found something I could drink. So I relate to the struggle. So yeah, I relate to your struggle with not drinking the hot drinks, coffee, but I have to admit, I cannot wake up anymore without caffeine.
That's the problem. You get used to it.
It's a problem, but you know what? I think it's kind of a good thing.
Sometimes I actually like to, I would love to develop the taste for it just because it's part of a social thing as well,
Yes.
Let's get together for coffee, grab me some coffee, I'm drinking coffee while I'm waiting for someone. For me, it's just water.
I mean, I can't relate, but I had my coffee and I'm a little bit awake now.
Good.
And so our shout outs for today, Dream Med scrubs. Just to let you guys know, and this is a true story, the other day I was on the wards and a friend of mine took a look at the scrubs and they were like, oh, can I feel the quality of the scrubs? And they were like, wow, that's really good. That's that good quality, and it's super comfy. So Dream Med scrubs, guys, we keep promoting them. I really recommend go out, check out their channel, order their scrubs. They're really great. I'm wearing them all the time on the wards. I can't promote them enough. And like we said, Doctors Brew listeners get a discount code. We'll show it here on the screen. And please follow our Instagram channels for more promotions. We drop stuff, collaborations like videos, stuff like that with DreamMed all the time for more, goodies. So stay tuned for that. And the next thing is Studio Stretch out in Shueikh. I mentioned it before. They're a new stretch studio in Shueikh. They can stretch you out quickly for 30 minutes. Shout out to Fiona from the UK there. She was super helpful in everything in my experience there. And be sure to check out we're going to be dropping a reel pretty soon of my experience there. It was super great. Again, sometimes we're sitting a lot as doctors when we're studying, not when we're moving on the wards. And everybody needs a good stretch. So check them out in Shueikh. Yeah. So let's dive right into the meat of the episode. Let's get into Dr. Joanne. So we want to know about you and clinical psychology. Tell us about your career choice and what led you towards this career.
Sure. Well, it is, and I'm very happy to say that it was a long journey. And I always say that because a lot of people think, oh, you're just a psychologist. And it sounds like psychiatrists wannabe. Because you didn't go into medicine or into the psychiatrist, then you became a psychologist. But in reality, it's a long journey, okay? I started ever since I was in high school. When I took the first psychology class in high school, I was just fascinated by the understanding of human behavior. And I think I had that natural sense also, that gift that I was able to in tune with people's behavior, connecting why this person is behaving this way because it's feeling in a certain way, So I had that, I would probably say, a gift. So very, very interested in the field. And then I decided I wanted to work with kids. Okay. And that's how I started. And so when I graduated from high school, I said I'm going to go and study something related to kids. So I thought maybe preschool education, children education, some kind of educational arena or environment. And then I said, but honestly, it's going to be limited. What are the things that I can do? What's the max? I always thought of what is the top of it. And I have to say that I was influenced by two very important people in my life, my mother and my elder sister, who is a medical doctor and was, but then specializing in psychiatry.
Wait, what do you mean back then? She switched specialties now?
Well, she's not practicing psychiatry.
Oh, okay,
she's now the vice president of a hospital. So, and she's a director of the transplant unit and the international center. So she's more into the admin.
Wait, transplant
unit, the department.
Sorry, that's just interesting because psychiatry, transplant,
Yep.
Okay, big jump.
But again, it was mostly administrative. So she doesn't do anything to do with transplants or surgery. No, it's just administrative.
Okay.
And yeah, actually, their hospital is the number one in the U.S. Ochsner is the number one for liver transplant.
Wow. So wait, where is that in the U.S.?
And Louisiana, New Orleans.
Okay. Oh my God.
Yeah.
Wow.
Yeah.
Super interesting.
So that she was introducing me to the whole thing of the potential of psychology, psychiatry. What do they do? And my mom always said, if you go into the educational area, you will be limited to schools and, become a teacher, become the head of the teacher, the owner of the teacher. Don't limit your opportunities. And so then I started, considering psychology, and I talked. I think this is one of the recommendations that I always give. Talk to people in the field, try to shadow what is it that they do, what are the opportunities or the different alternatives that they can have. And I got biased, I just fell in love with it and I said, this is it. So I studied psychology back in Venezuela, which is a different kind of program than, let's say, than in the U.S. It is a 5-year program, and you go directly into psychology. So it's not like in the U.S. that is a 4-year general college degree, bachelor's degree.
Right.
No, in there is just from day one you're in the psychology college. Okay. And it's a 5-year program, not a 4-year program. So back in the States, it will be equivalent to that 4+1, they call it.
What is that?
Like a 4-year college plus an extra one that is almost like a master's.
Okay.
So, and then you do not graduate with a degree, let's say a bachelor's degree in psychology. No, you graduate with a clinical degree in psychology.
Okay.
So
what would be the difference there? Because that when I asked in the beginning, psychologist, clinical psychologist, I'm aware that there's a difference. Like one is research, one is more application.
So then that's a good question. Again, back in Venezuela, you can choose which area you want to go to. You want to go into the educational, into the clinical, into the perhaps forensic psychology. Which one you want to go into? And I chose clinical. Okay. So that is towards the last year. Then you start choosing, and you do a dissertation. You have to have a dissertation. You have to have 2 years of internship hours. So it is really tedious, and it is almost equivalent to a master's. Okay.
Right.
So by me choosing clinical means that I got into the diagnosis component, into the abnormal psychology, all the different diagnoses, into the assessments, the clinical assessment part, where we were taught how to administer the different psychological assessments.
Right.
Which is fascinating. And so then after that, so that was a 5-year program. Then after that, I moved to the States, to the US to do my master's degree. And my master's program was a 2-year program from Loyola University. And so then after that, I did my PhD, which was a 3-year program. So now right there, we're talking about almost 10 years. And then I had my licenses. I had to work about 2 years to become licensed marriage and family therapist and licensed professional counselor.
So time-wise, you're not saving any time.
That's exactly what I was trying to say. You know, like when people say, "Oh, because you didn't go to med school," I'm like, equivalent to, with all the respect to all the medical doctors. You know, I have a kind of like 12-year educational background, you know.
But okay, well, I want to press you on something. There's one thing that when I look at, like, for example, therapists, like online, what are the the different options for therapists? There seems to be a lot of fuzziness about who can deliver therapy and their qualifications. It seems to me, my impression, I don't know, that it goes anything from someone with your level of experience, who's gone through a degree, a master's, PhD, et cetera, all the way down to someone who hasn't necessarily even studied at university and has done a course in being a therapist. So what is the differences? How does this, is one better than the other? What do you think?
Yeah. Good question, and I don't know if this is a time maybe where I should kind of mention a little bit about the difference between a psychologist, a life coach, because we need to.
Difference.
It's a big difference,
No.
And so that is based on that, on the educational level and the years of educational background that you have. You can compare someone with 12 years of an educational background with someone that just got a degree in 1 year,
Yeah.
So they might have the passion, they might have the gift and the intention. I always want to say, I want to give them the benefit of it, that they do have the good intention. But do they have the right professional tools and educational background to know, this is something deeper and we need to handle it this way?
So why can they deliver therapy?
Why?
Yeah.
As long as there's consumers, as long as you go to them, you will always be building them, and that's one of the biggest problems we have in Kuwait. A lot of people say, oh, going to Dr. Joanne, no, oh my God, a psychologist, I don't need it, I'm not that bad, I'm not crazy, and I hate to use this word, but they use it all the time. And I think so then instead of going to Dr. Joanne, let me go to making a name, Sarah, okay? Because she's nice, she's a coach, she just has the training, but is not a psychologist. So people think that is less severe, their condition, and so then they go to these people. So these people, I know a lot of coaches that charge probably 3 and 4 times more than what I do. And they don't have the qualifications, Actually, I had a client that went to a life coach for marriage consultancy, let's say, to concerns. The coach told her to start using more of this, doing more of that, to wear some kind of clothes. And she developed an eating disorder because what was missed is that the self-esteem was not at the right place, I would say. Yeah. And the client developed an eating disorder, hated her body, started to, I would say, avoid food or certain things. So it was very, very limiting to her eating. And when the coach realized that, she said, oh, I don't work with eating disorders, so I think you need to go see a psychologist.
Well, I mean,
so
you need to know your limitations.
Exactly. Yeah. And that's what I always say. We need to know our limitations. But okay, the therapist or the coach, but what about the consumer? They don't know any better. Yeah. So they need to, and I love this kind of sessions, podcasts, interviews, all that, to educate the consumers. You need to know what are you looking for, and you need to know at what point this is not what you actually need, and it's not going to be beneficial for you,
Well, arguably, I hope I don't get too much hate for this, but should it then be that people who don't have, like life coaches, etc., they should not be allowed to provide these therapies? Because to be honest, like, I can't imagine a situation where I'd say someone who's not a medical practitioner, whether it be a nurse, physician's associate, or doctor. Well, I mean, in Kuwait, nurses and physicians associates have different practicing capabilities in Kuwait, license-wise. Anyways, I wouldn't want someone to be like, right, I am, which we have a lot, also with cancer. Cancer patients, often, especially in Kuwait, and psychiatric patients, there are a lot of these traditional herbal healers, whatever. And a lot of times, they make things worse.
I mean, with all the respect.
With all the respect.
And
because they're trying to do good.
People that's what I said at the beginning. Yeah. I really want to believe that their intention is a good one.
Yes.
But I think is also, I would say, the consumers. What I mean, the customers, the clients, the patients, the person ill, wanting to believe on anything, believe that this oil will fix your problem.
I've been there.
Exactly. And that this water, if you take it with these drops, it will cure the problem. I will try everything. I don't blame them. I will try everything, But I think it is important to give it the level of importance, I would say, to the science at the same time, to that background, to that educational research. Psychology is not something that is a new field. It's been out there. So there's some science attached to it for a reason.
Then, okay, let's you like you mentioned at the start. You said that psychologists kind of like there's this view that psychologists are just the next grade down from psychiatrists.
Some people see it this way.
Yes. Like there's this, Now, I want to I'm going to tell you my story of how I got into medicine, and I want to know what are your thoughts about the difference between a psychiatrist and a psychologist as someone who's aspiring towards a career in psychiatry. So
love it.
I think I've mentioned to you, I've always loved psychology. I've always loved philosophy, and you knew my father.
Yes.
He was
Yes.
huge on psychology, huge on that kind of stuff. So the Rida al-Khayyat effect was quite strong in me.
Yes.
He taught me a lot of that stuff growing up, and so I wanted to pursue a career in psychology. I did summer courses in the States. I did courses in high school. It was a big thing for me. But then he always what he told me was like, for the Bertha program, this is a unique opportunity for you to go to medical school. And he says that you can always, even, you can do med school, you can become a psychiatrist, and you can always still then shift your career.
Shift, correct.
He always said that's, you will not close this chapter if you by going to medical school. So keep an open mind, go, and that way you can at least have, even if it's just prescribing is still it's a thing in your arsenal. It's over going to towards a career in psychology. Says because you have this opportunity. I took it, and I'm working, and I fell in love with medicine. For people listening, medicine is not all. I love it. It's great. I want to end that kind of talk. It's very tough. So, but now the more I've gone through medicine, the more that I've seen psychiatry, the fuzzier the role of the psychiatrist is, because I was influenced by people like Carl Jung. Carl Jung, he's the one who came up with theories on the collective unconscious, etc., etc. He's a psychiatrist. He's not a psychologist.
Yeah.
And psychiatrists more and more now. Actually, wait, I have a study about this. Data collected from the U.S. National Ambulatory Medical Care Survey showed that psychiatrists practicing psychotherapy from 1996 to 2016 has halved.
Yeah.
So, what is the difference between a psychologist and a psychiatrist? And a step further, should there be a difference?
Absolutely. We have to be clear on this. Absolutely. But I think the key, and this is what hopefully in Kuwait we will see happening more, is that they work together. It's a teamwork, I worked in the States for several years, and that was beautiful. It was like in the team, they had to be always a psychologist and a psychiatrist on the table. That's not necessarily the case here in Kuwait. But what is the difference, just to answer that? The clear difference is that a psychiatrist is a medical doctor. They went to school of medicine.
Yes.
Okay, they graduated as a medical doctor. Psychologists don't. As a medical doctor, a psychiatrist can prescribe medication. Psychologists don't. And please, I would like to clarify, psychologists do not prescribe medication. Nowadays, in the States, in the U.S., there are 2 states, if I'm not mistaken. I'm not that updated. I think Alaska, I don't know which ones, but there are 2 states that are starting to provide psychologists, if they have a specific coursework on pharmaceutical education, that they can prescribe medication.
Okay.
So it's not something big. It's not everywhere, but I guess it's kind of starting. But they have to have the particular educational background, and it's quite tedious in pharmaceutical background.
So, okay, the psychiatrist can prescribe.
No, psychologists do not. I just don't want to confuse people.
Psychologists can prescribe, psychiatrists can prescribe.
Yes.
But here's my issue. Psychiatrists can prescribe, great. But what I've seen, that there is a greater shift that the psychiatrists we come real quick.
In and out. 20 minutes.
15, 20 minutes.
Yep.
Here's your pill. Bye-bye.
Yep.
And there's a logical reason for this, because, you need to allocate care. Their psychologists
Absolutely.
are more, But is that good? Arguments have been made that having too much health care, the more personnel that a patient has to deal with, the less likely they're going to seek care. The less good the care is.
True. It's almost like the more stops the patient has to go through.
Yeah, like a psychologist and psychiatrist and somebody else, too much.
True. Okay. I would say there are several psychiatrists that also do therapy. Okay, so they're therapists as well. Actually, that was one of my mentors. She passed away during COVID. She was amazing. She was in Florida. And she was a psychiatrist and a therapist, so she would do psychotherapy as well as prescribe medication. But that is not the common factor because of, again, I think there is a different components playing a game here. One of them is the amount of patients that they can see in 1 hour, and if we come into the financial component also, it's a big deal. You know, I can see 3 patients in 1 hour and make this much money, as opposed to 50 minutes, 1 patient, and make this money. You know, so I think there's also the financial component there. I want to say that maybe not everyone, okay, but if they have a good teamwork with a psychologist, then they say, you know, you need to see this person on a weekly basis. This person will give you tools, strategies, will be able to be with you for 50 minutes to an hour, you know, to sit down and go over your life, you know, all the different life components, factors that are involved in this presenting complaint or problem. And the doctor is focusing more on the prescribing. How is the medication working for you? What kind of side effects are you getting? Should we increase, decrease the dosage, change the medication? Okay, so they're more focused on that medical component of it, which is fine as long as there's a very close, again, connection between the two professionals. One of my concern has been the fact that I see the client, we call them clients, we don't call them patients. I see the client for 50 minutes to an hour on a weekly basis. You can only imagine all the things that we discuss in this hour, right? Details from the upbringing, from my day-to-day, from partners, family, friends, emotions, day, night, eating habits, social interactions, you name it. Okay?
1 hour versus 15 minutes, the number alone.
Exactly. So then I can see that client as a package, as an entire human being with this. When that client goes to a psychiatrist, okay, and the psychiatrist gives him or her a questionnaire, answer this, and then they get an answer, oh, you're depressed, okay? And I'm going to give you this. Of course, they answer some questions, they ask some questions, and da-da-da-da. And of course, their experience, I'm not going to minimize that. But in 15, 20 minutes, you know, it's quite hard for you to say, this is what you have. And so when I refer someone to you, for example, Aziz, and I would say, I'm referring this client to you because she is suffering from anxiety, okay? And you see her, and then you say, no, she's depressed. Well, we do know that actually, I would say, Joanne says this, 90% of the clients who suffer from anxiety also suffer from depression.
Comorbidity, yes.
It's comorbidity. And so, yes, it's true. She is also having some depressive symptoms, but the core, the presenting, is anxiety, okay? And that's what I want you to treat the most. No, very depressed, this is what it is. So I think that's when we need to start trusting each other. And then you come and you tell me, I'm the psychiatrist, I'm the one that knows, you know?
So there needs to be a stronger...
Respect. And that's what I hope to send the message in this podcast, is that trust also the fact that we do have the knowledge, you know, we do have the academic background to see. Maybe not in every single case, maybe there are some more in-depth, maybe we're talking about schizophrenia, bipolar, maybe some severe cases
this is where the
that are maybe
psychiatrist
the medical component.
Yeah.
Maybe there is a MS, let's say a multiple sclerosis case, and has a mental, you know, component as well. That's when the medical doctor will come in, you know, there's a blood disease and then there's a mental disease, you know?
Yeah.
But we gotta trust each other, you know, and we need to trust the fact that I sit with this client for an hour a week. Trust me, you know? And so the more we can open those channels of communication, the much better service the patient or the client will receive, you know?
Now, do you think, in your experience, psychiatrists don't their psychological knowledge is not too strong, or is it strong?
Good question. It depends on how you define the psychological knowledge. I think they do. I think it is good, but the application of it, the actual implementing it, is what I think is lacking. Okay? Keep in mind the training, and I don't know much, you probably will be able to share more about it, but the training of it is rotations.
Yes.
How often you go, how much you stay in a room with a patient.
Yeah.
It's a rotations. You go,
the more senior you are,
yes,
the less time with the patient.
The less time. So what happens to your skills? What happens to that knowledge?
Back.
Exactly. It becomes more automatic. So then again, you have the knowledge, and you probably have it even more than any psychologist, but the application of it is different. We are trained to be long hours. We're trained to be talking and de-escalating when the problem gets to a level.
Yeah.
The psychiatrist immediately will say, let's medicate it. Let's give it something to sedate, to calm down. Cannot work like this. We have the strategies to go through the process. We have the strategy to de-escalate.
So, if, let's say, what about in terms of the psychological knowledge, the psychiatrist? Would you say the psychological knowledge is more so formal or from experience, in the sense of, like, there's a very big difference between saying, this patient is clearly sad and you can tell because of XYZ, versus, as per this theory proposed by this psychologist, their probably unconscious mind is acting in this way, and this defense mechanism is acting blah, blah, blah. There's a very big difference between those two things. Yeah. Do you feel like psychiatrists have that kind of formal understanding of the mind?
Probably not.
Probably
not, because that's not what they study.
Okay. So how can they study that, though? Because this is a new change. Again, before, we're looking at the 70s, 80s. Psychiatrists this was their stuff. They're the ones, a lot of psychiatrists
that actually created it or invented it or discovered.
That's what I'm saying. Yeah. So what happened?
It got shifted, and I think, again, I don't want to go back to that, but it got shifted because of the demand. And so again, a psychiatrist spending hours researching the theory of something, when now we just need to go and see all the patients that need medication. You know what I mean? So that's how the psychologists became the researchers.
Yeah.
And now you see a lot of the researchers are psychologists, not psychiatrists.
Yeah, that's absolutely true.
Exactly. Because they were focusing more, now the psychiatrists are focusing more on the impact of the medication.
Yes.
And you talk, I take my hat off with full respect when I talk in front of a psychiatrist and the psychiatrist says, this medication will have this side effect and it will affect this and this and that, so it's better to give him this than this. Amazing. That's what they study. Yeah. You see?
Yeah.
But again, the implementation of the theory, leave it to the psychologist, because that's what we research. That's what we do. We go into the theory, into the reliability of it. Can it be reliable? Can it work with Middle Eastern clients, and it can work with Westerners?
Yeah,
it can work in Japan, and it can work in China, and it can work in Saudi Arabia and Kuwait.
Yeah.
That's what we do.
But what if a psychiatrist wants to be, let's say, more psychological savvy?
Absolutely. Welcome.
How do we do that? How do they do that?
I think there's got to be courses. There's got to be different courses.
So there needs to be formal education?
Yes.
Okay.
Yes. I think also it comes to the interest of the doctor.
Of course.
What is your interest? Is your interest in a particular condition? Like, for example, let's say depression. So then you go into the whole arena of depression. What are the theories? What kind of techniques? What kind of research we have? The latest research on, for example, I talked to a psychiatrist about mindfulness, and a lot of them will say, okay, I have to go now, when I've seen in my practice the amazing impact that mindfulness has on the well-being of the client, of the success of the client, mental health, So this is more day-to-day that the psychiatrist will probably not spend that much time on it, So again, it's just the interest.
Right.
I think it all comes to the interest. What is your interest? What do you want to sit with your patient and give techniques and look into this? Then you have to have that training.
Right.
But I think the interest has been on medicating, stabilizing them, and passing them to us.
Because the focuses are different.
And I'm very happy. I mean, I don't want to mention any doctor right now, but I'm very, very lucky, happy, fortunate that I work closely with a lot of psychiatrists in Kuwait. And they referred the clients to us. They're go see Dr. Joanne. You need to see, you come see me every month, every 2 months, but you need to see her every week, or So there is that, again,
alliance.
Trust and believing in what we do. There are others that say, no, you don't need to see her. I'm giving you the medication. You're stabilized. You don't need to see her.
Yeah. But so on the topic of medication, I've from afar, maybe I'm wrong here, so that I'm not saying this is a formal study or anything, but I have this, from afar, I feel like there's this weird clash. Psychologists hate medicine, and psychiatrists, doctors love the medicine, and then they fight. And what I've noticed a lot of times is that the combination is actually the best thing. Studies have shown the best treatment for depression is not just sertraline, like antidepressants, but it's actually sertraline and the therapy.
Absolutely.
What do you think?
Again, I would say it varies between person to person. I don't hate medicine. Again, I see it as a crutch, as a tool. If my bone is broken, I need to heal it, and I need to take anti-inflammatories, I need to take antibiotics, I need to take whatever it needs in order for my bone to heal. As well as physiotherapy and all kind of stuff. So it is all a combination of it. It's all a combination of things. So I think that the more we understand the benefit of both, the more beneficial it will be on the long road. I don't think that the word should be psychologists hate medicine. I just think that is not all. Okay. And I always say, and also to everybody hearing this, I always say, the longer you wait, the more severe the condition will be. Then for sure you will be needing medication. You will need medication. I have clients that have come to me really in a very bad shape, and the first thing in my first session I say is, I'm sorry to say this, but in order for us to continue, you need to be on medication, because then my work will be pointless. I will be talking to you for a whole hour.
Nothing's getting through.
Nothing is going to get through. If let's say again, depression. If your depressive levels are very, very, very low, or very high, I would say your energy, your way of coping with things is very low. There's no way I can start implementing some kind of techniques with you, because you're going to be, I'm lucky that I'm here, that I actually can brush my teeth. There's clients that cannot even get up and brush their teeth. And I'm going to tell them to do this and this and that. So I need to stabilize that chemical imbalance through medication. So then the therapeutic approach can come in.
So what I've always explained to patients is that the pills, the medication will take the symptoms,
the
somatic symptoms, the fatigue, etc. But the ruminations, the thoughts, the psychology,
and what caused it will stay there.
That's there.
Exactly.
Now, what about this is where things get a bit mucky and gray. What about conditions like bipolar disorder, schizophrenia, where the approach is primarily medication? What is the role of the psychologist, if any?
It definitely, there is a role, and it is because it's a supportive ally. The person with bipolar, which I do have quite few clients with diagnosed with bipolar, the primary treatment is medication for life. You have to be on medication, and you have to understand that.
Yes.
Okay. However, my work with them is to work on how the day-to-day is impacting them.
Okay.
You know, their relationship with the spouse, their relationship with their coworkers, because they get triggered, right? And they're having ways of dealing with their emotional state is different than maybe any other person. So again, is how is this impacting you, affecting you, recognizing triggers. You start recognizing also some of your body somatic symptoms. I notice that I'm a little more agitated. I'm sleeping less. So then I need to go see Joanne. I need to go start talking about what can I do. So we start looking at the whole day-to-day components that are affecting your emotional state. Medication is there, and your medicine, your meds are working. Okay. But what is happening is when my mom comes and tells me this every day and just really gets on my nerves, and how to deal with that. When my boss comes and demands this and it triggers my emotion and it makes me, how to deal with that. You see, society. I go to places and I get aggravated by certain things that the society is imposing on me. How to deal, how to view the different perspectives and approaches to that. That's what we deal with.
Right.
That is not handled by the medication. The medication is targeting the somatic, the chemical imbalance,
Now, controversially though, what do you think on a spiritual level is the role of the psychologist? Because a lot of patients will really come with, and especially culturally, they will say, right, I need to pray this away. So how does the psychologist come in here?
Listen, a good psychologist, and I would say this, a good psychologist is non-judgmental, is completely unbiased, okay? You will meet me and you will know me for about a year, and you don't even know what religion do I practice, if I am straight or not, if I have some kind of problems at home. You will not know, because I'm completely neutral when it comes to that. I am here for you. And so if that works for you and you have this belief and you think that praying will help you, let's use spirituality as a tool. I just don't want you to think that that will be it. And a lot of therapists use that. You need to pray more. You need to pray more. And a lot of the clients that I see is like, I left that therapist because that therapist kept telling me, you need to pray more. But those are your beliefs, not mine. Respect that, So if it's working, if you think that you need to... Now, one of the things that is away from religion is faith. You gotta have faith. You have to have. You have to believe in something, because if you don't believe, you won't even believe in the process that we're doing right now. You won't believe in me. You won't believe in therapy.
Well, I think it was Carl Jung who said that there's intellectual, emotional, and spiritual intelligence.
Spiritual, absolutely. It is Jung. And so then what happens is that if that spirituality is not there, who am I dealing with? A stone, and so how can I actually get those emotions out and that hope of a higher power? I used to work in a substance abuse inpatient institution, and the first kind of command or rule was to believe in a higher power.
The 12 steps.
The 12 steps program, And so you have to believe that there's something that will help you heal.
And how does that play with atheist patients?
It doesn't matter. Atheist in what?
What do you mean?
That's, again, you're atheist religiously. You don't believe, I don't know if we want to go into that, but you don't believe in a particular God, right? But you got to believe in yourself.
That's interesting.
So to me, that's not atheist. If you don't believe in yourself, you got to believe in yourself. You got to believe in me as a therapist. Otherwise, why you came here?
What I'm hoping people are taking away from this is that the role of the therapist is also to use spirituality as a tool.
It is.
It's not to push you away from it.
Exactly.
So for anyone who's listening who thinks that psychological therapy is avoiding, is just saying, is taking spirituality away, taking the role of religion, faith, whatever away, it's not.
Religion, again, let's don't get confused, Religion is different.
What do you mean?
Well, because I don't want to be in terms of like, I'm going to tell you to become Muslim when you don't
Right.
believe in Islam.
Right.
Or tell you to become Christian when you don't believe in Christianity,
Right.
you know? But I need spirituality in the game, in the process.
You
gotta
just use whatever the
believe
patient...
Whatever the patient believes. You believe in the light bulb and the water will heal you. Let's believe that the water will heal you, you know? In terms of faith, I don't know if I'm confusing, but you gotta believe in the process. I always say the reason why you're here to see me is because you hope that I can help you.
So it's an unbiased...
Exactly.
Okay.
Regardless, there's no religion involved or anything.
Okay. I want people listening to take away because I have seen, cases of people being afraid that this is going to affect the way that they practice, and it shouldn't.
Exactly. It shouldn't. Okay.
Shouldn't.
If that, no, not at all.
It shouldn't.
Not at all. And it doesn't matter what religion I practice, if I do, if any.
Yeah.
It doesn't have anything to do with
separate.
that. We're talking about science here. We're talking about spirituality here. We're talking about perspectives of, ways of thinking. And that's what the psychologists work with.
Right.
The distortive thoughts, working with the mind. My orientation is mainly cognitive behavioral therapy. And we work on the connection between the way we think affects the way we feel. And the way we feel impact the way we behave.
Cognitive behavioral therapy. I'm going to press you. I'm sorry on this. Criticism of cognitive behavioral therapy has been that it doesn't look at the core root of a behavior of why the maladaptive behavior or thoughts are coming, but rather it teaches ways to cope with it rather than understand what caused it. What is your response?
True. To a part of it. But that is why this is me, Joanne, saying I don't believe in one solely approach. And so, maybe you can have an orientation to formulate your therapeutic plan, but then from there you go into different things. I use cognitive behavior. I use positive psychology. I use, again, like I said, techniques from mindfulness. I use client center focus therapy. I work with narrative therapy. I work with, the only thing that I don't work with is, I would say, the psychoanalysis. I don't go back to the past and dig into it and believe in hypnosis, and I never practice it, to the respect to all of those who practice it, but I don't. There's DBT. So there's many different approaches that you can use depending on the case, and that's what I do.
It's kind of weird because there's no right way.
Exactly.
It's kind of frustrating, actually, for me, coming from a medical perspective.
Again, that's the beauty. That's what I say, is the beauty of it. Why? Who are we dealing with?
Who?
Humans. Is there a right way, wrong way of being a human? No. Are you going to tell me that I'm wrong?
No, that's true.
Exactly. So how can I say, you need to think this way? You need to solve your problems this way?
It's so
fascinating.
It's fascinating, but because for example, for me, like studying in the UK, it was all about the NICE guidelines, the National Institute for Healthcare Excellence, and the NICE guidelines, psychology therapy wise. This is just my opinion from what I've seen from the outside. Is I don't want to say it's slightly biased towards CBT, simply because CBT is more easily tested. CBT is cognitive behavioral therapy, for anyone listening, is more easily tested in randomized controlled trials, et cetera, et cetera, et cetera. But then there's also there's other forms of therapy that, like psychoanalysis. I'm fascinated by psychoanalysis, but it's very difficult to objectively test.
Yes. True. And again, it's many different approaches that you will need, in order to go into that. And to me is how would I call it? Not successful, but how I don't want to have my client, discouraged being in therapy for 3 years, because psychoanalysis can be long,
Yeah.
so I want to give them that sense of we're getting there, you're getting somewhere, you're
quick.
seeing the changes. I'm more, let's worry and let's concentrate on the present. The past is done. We want to understand it, but we can change it. So what we can change is what we're doing today in order for our future to be different than our past, and that's a little bit of that foundation of CBT.
Now, as a psychologist, what do you think about? I this is my personal opinion. This is not based off research, but I think that psychology, like going to therapy, would be useful for anybody, not just if you're necessarily symptomatic.
Please, yes. And this is another message we want to send here. That's the myth, and that's the part that needs to be gone. And that's the thing. The psychiatrist, one of the differences, a psychiatrist is there when the problem is there. When, yes, medication is needed. At times, maybe medication is not needed, but there is a condition, okay? Maybe not as severe. But a psychologist is for everyone. I always say everyone should have in their phone book the phone number of a psychologist.
I mean, I've recently started seeing a psychologist.
Absolutely.
And the thing is, I don't fit the criteria for depression or anything, but after my dad passed away, I definitely had some existential questions I was thinking about. Exactly. And I wanted to think about it in a non-judgmental, objective space, But it's not because I need to go and...
Everyone. If you have children, how to raise them, or not how to raise them, but what is the best approach? Is this right for my child, for me? It's not a recipe book, step 1, step 2, do
and
this,
what
do
does
that.
It affect in you?
For me, it's tailored to you. So I get to know you, I get to know your environment, and I get to know what's best for you,
Yeah.
So, and it's a safe place. I always tell my clients, this is a safe place. When you leave this door, you say, done, I left it there.
Yeah.
Not like if you have a good friend, for example, that you can vent and talk to the good friend or a spouse or something. There's always that degree of a percentage of information that either you regret saying or that you withheld, I'm not going to say this to my husband because he will think this and this and that,
yes.
or he will be worried, or I don't want to worry him, or there is something, why did I say that? Now he's going to use that against me, or what would he think? So there's always that. With a therapist,
it's not there.
Nothing. There should be no regret.
I mean, my favorite comedian, Bill Burr, he once said to a heckler, he made a joke and the heckler took it badly. And then he responded by saying, see, I didn't say what you're saying. I said something. You got it chopped up with your childhood, okay? And now it's something else. And the way that I see it is that the therapists, they don't do the chopping up with your childhood. They're, blank.
We work on it.
Yeah.
We accept.
Yeah.
Exactly.
Non-judgmental, non-biased.
Non-judgmental, yes.
Love it.
So yes, everybody should.
Now, as the president of the Psychological Association of the Middle East, I think you are the best person to comment on what is the status, like where are we here in Kuwait and in the Middle East compared to maybe the outside world? Where are we?
Well, that's a very big question because it depends on the aspects you mentioned. Okay, so if it is regarding standards, knowledge, research, we're way behind. I would say very much behind. Let's talk about and not being judgmental, but let's talk about Kuwait.
Yep.
Okay, so first of all, I am the president of the Middle East Psychological Association, and I'm based in Kuwait, but we have chapters all over. We have UAE, Jordan, Bahrain, Qatar, Lebanon, Kuwait.
Really all over.
And I'm missing one. UAE, Bahrain, Qatar, Jordan, Lebanon.
Egypt?
No, Kuwait. Oh my God. Oman. Sorry, one of the most active ones. So 7 chapters all over the Middle East. And unfortunately, for example, in Kuwait, we do not have a licensing board.
That I was about to ask that earlier. Yeah.
So do you know what that means?
It means that life coaches can give
It
therapy.
means anyone can be a psychologist practicing.
There we go. Yeah.
We have bachelor's degree, recent graduates having a clinic and practicing.
Yeah.
You know? And so to me, that's quite dangerous. You know?
Yeah. You need to have standards. In any healthcare, you need to have standards.
Exactly. And you have not only the standard, but the licensing board that oversees. You have to have that motivation. Unfortunately, if it's not internal, it has to be enforced by an external body that says you need to do this number of hours every year of professional development. You know, in Kuwait, we don't have that.
Yeah.
So people say conferences, for example, we put these events, we bring like more than 50 international speakers from all over the world, amazing, top practitioners and researchers, and the people, why would I attend? Oh, sorry, no, I had a gathering, so I couldn't attend the conference. And these are psychologists in the field.
Yeah.
Why? Because there's no need for professional development hours. So that internal motivation is not there, so no need, you know, but we need to be able to enforce that.
So we need some standardizing in Kuwait.
In order for you to practice, you need to have this license. You need to have this number of hours every year. Why? Because psychology is a field that is just evolving on daily basis, you know?
Yeah.
And especially, for example, we see it now after COVID, a big boom. Before in Kuwait, we were not able to even mention the word suicide. We will be shut down if we mention the word, you know?
Really?
Yeah. And in an event, like if I have a title saying of a presentation with anything to do with suicide, it will be shut down. And so then now...
That's crazy though, because that's the backbone. Sorry, like for anyone listening knowing about psychiatry essentially, step one, is this patient at risk of suicide?
Yeah.
Wow.
So but then again, we talk about it. We see it. We see many cases, but we don't, And so now after COVID, it has been the boom. Now is presenting cases. Now we see it in hospitals. Now people talk about it.
COVID
now they
boomed.
refer,
mental health. I published an opinion, like a letter about this, and it was well shared and whatever, because I predicted right before COVID hit, I looked at the definition of a mental health disaster, and then I said, right, COVID constitutes that, and that we should treat it using the principles of disaster mental health management.
Yeah.
Of course, that didn't happen. Here we are.
Yeah.
Cases have doubled.
So this is I used to work before my clinic. I used to work until 6 o'clock. Now I work every single day until 9.
Really?
And I'm still not keeping up with the man.
Wow.
You know, so and I always said is wartime. I cannot just go and say, okay, now I'm gonna go home at 6 o'clock, you know. No, we were trained for this. We were ready for this wartime, you know. And I'm sure it's not gonna last. Hopefully it's not gonna last, because we're educating people. People are seeking help. They're talking.
They are.
They're being more aware and actually admitting, I need to go see someone. I've had in the past couple of months people coming to see me for the first time saying, I noticed some things were not right. My mood, I'm easily irritated, and I just wanted to come and consult with you. Amazing.
That's huge.
That's huge. That's
stopping someone before it becomes a pathology.
Yes. I have a client who has a mother being diagnosed with bipolar and grandmother with a severe depression. And she comes, she's fine. She's in her early 20s, and she comes once a month to see me. And I'm just fascinated. And she says, I came for my monthly check-in, you know, and she just talks about what's happening in her life and at work. She goes and she does physical activity. She exercises every day. We talk about her social, you know, life interactions. How are they? And she says, this is my contribution to preventive.
Yes.
And this is key.
This is exactly what I did recently with
someone
being a therapist.
with that history or genes, okay, is more prone than someone else, right?
Yes.
of developing a mental condition. But she's doing what she needs to do.
This
to
is looking
prevent
after your health.
Exactly.
That's
There's no health
100%.
without mental health.
Oh no!
Yeah.
When people ask me why are you going for psychiatry, and I give a very grim response. I always say, you can do a surgery, you can do your antibiotics, you can do anything, but in the end, if that patient leaves this hospital and goes and commits suicide, you've done nothing.
Your work was nothing. Yeah.
Nothing.
True.
So that's it. It always boils down to mental health.
Yeah.
Well, I think those are all the questions that I wanted to ask here. This has been a fascinating interview.
Hope I answer.
No, I loved hearing the perspective outside of medicine, in healthcare, but not outside of medicine, because I think one thing we always learn in med school is that don't be biased.
Yes.
Gain perspectives,
Yes.
gain views. And so the only way that we can break the bias is by hearing, that's why we need to, in MDT meetings, you need to hear from nurses, you need to hear from
Yes.
physiotherapists, you need to hear from everybody to be able to give one solid treatment plan for a patient. So I hope everyone here listening, watching, has been as fascinated with this interview and as motivated as I am. Thank you so much for coming.
Thank you. Really, really a pleasure. Time run fast.
No, like that.
And I can talk. That's for sure. I can talk.
Every guest that comes on, one of my first guests, they said, "Oh, what am I going to talk about for 1 hour?" I was like, "Okay,
Trust me, it will pass.
just come, just come."
Yeah.
Anyway, so that's the last sip of coffee for the day. A final special thank you for our guest, and last shout out to Studio Stretch in Schweich and Dream Med Scrubs. Again, go check them out, and please follow our socials and to keep up to date with the Doctor's Brew. Until next time.
Thank you.
Hope you all enjoyed this episode of the Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.